diagnosis, because after all, that's what this is all about in the end. Once breast cancer is confirmed, there are many factors we take in consideration so that we decide on the treatment plan. When I say we, it's a multidisciplinary team decision. So you might be seeing one phase in the clinic, but then you need to know that there is a whole team on the background working on the same case. It's a multidisciplinary approach. And we take into consideration the risk factors of the patient. So we usually look at the age, the tumor size, the lymph node involvement, yes or no, the extent of the disease, but then also the biology of the breast cancer. So it's not one size fits all. Every patient is unique, and our approach will be really tailored based on that specific patient. Depending on the biology of the breast cancer, we will be using different treatment options. We can use chemotherapy, which is an intravenous infusion that will try and stop any rapidly multiplying cells. We can also use some oral tablets, the endocrine therapy or the hormonal treatment as commonly known, that will block specifically the hormone receptors that can be expressed by the tumor. We can also use targeted therapy, which will target the HER2 pathway, and immunotherapy in few rare cases, and it's the triple-negative breast cancer type that can actually respond to immunotherapy when we are using an intravenous immunotherapy that will enhance the patient's immune system to go and find the cancer cells. Earlier, it was breast cancer, mastectomy for everyone, chemotherapy for everyone, and then radiotherapy almost for everybody. But nowadays, based on those thousands of patients and the clinical trials that have happened around the world, but then also in Kenya, because we nowadays have clinical trials targeting breast cancer at the Aga Khan University Hospital, we know how to tailor our treatment, and a lot of de-escalation has happened. So in terms of surgery, we are less and less morbid, less and less invasive. So we do breast conservation surgeries more often than before. And then in terms of systemic treatment or radiation, as I mentioned, it's not one size fits all. But nowadays we know which patient will require chemotherapy, so we are less and less using chemotherapy for early stages, and we know which ones will require the targeted therapy, which will not require. So it's more towards the precision oncology type of approach, and then for each specific patient and subtype of breast cancer, we have unique kind of treatment. It has been proven that having a healthy lifestyle does improve managing the side effects during the treatment, but it does significantly improve the survivorship of the patients. And when I say lifestyle, what we usually advise our patients in the clinic is to have a healthy diet, which will be low in carbohydrates, rich in fibers, vegetables and fruits, and then trying to consider natural food rather than genetically modified food or processed food. And then having physical activity, and we recommend at least 150 minutes a week of physical activity, which, as I mentioned, helps coping with the side effects during the treatment period, but then increases the survivorship. And the last thing, stay away from alcohol and tobacco, which is really part of also the healthy lifestyle. From day one of the diagnosis, what we do at the Aga Khan University Hospital, we do not only take care of the cancer as a physical illness, we also take care of the mental well-being of the patient, and it's usually immediately followed by psychological evaluation as part of our and we have our and less toxic to the patient as of 2025 compared to the earlier years where we started treating. And it's something that will make them feel
documentation. Photos.
When you're telling the judges court orders are papers or they will not obey court orders, you're sitting and you're seeking orders. So how are they supposed to interpret it? Isn't it an oxymoron?
You see, the judiciary that seems to be under some control somewhere. You start questioning. We have very powerful governors, but they don't use their offices to serve the people. If you are not shameful to do what you are doing, why should we protect?
I'm human, everybody's human. So when you're told, kuja tuongee, I mean, you'd be a fool to say, "Sitaki kuongea nini?" Conversations have to be had, you know?
People in leadership should only go into leadership if they are ready and willing to change the world.
The Situation, Kenya's biggest conversation.
Good morning, and I love your show.
Thank you.